It's been sold as the ultimate cheat code, the magic weight loss solution. One simple weekly shot and your long-term body struggles just vanish. But in the world of medicine, there are no miracles, only consequences. And this wonder drug, semaglutide, is hiding a brutal biological trap that is quietly charging you a price you didn't agree to pay. Today on the Doodle MD, we're cutting through the noise. We're going to open up your body and show you the terrifying truth of what this popular shortcut is really doing to your internal organs, starting with your frozen stomach. To truly grasp the severity, let's talk about Sarah. Sarah, like millions, was fed up with dieting. She started on semaglutide, and the weight melted off. It was incredible, but 5 months in, everything shifted. She woke up one day with such intense nausea she couldn't catch her breath. She brushed it off as a nasty stomach bug, but the vomiting didn't stop for 3 days, forcing her to the ER. The diagnosis wasn't an infection. It was the side effect she never saw coming: gastroparesis, the very danger we'd just set up. Her organs had become so accustomed to the chemical pause that when the body tried to normalize, they simply seized up. Sarah's case isn't just an anecdote. It's a chilling reflection of a systemic danger the rush for quick weight loss is ignoring.
Disclaimer time. I'm the Doodle MD, not your physician. This is for education only. All scientific references are linked below. I am here to expose the risks, not replace your doctor. Talk to your actual doctor before making any decision. Let's continue.
The first organ to fall into the semaglutide trap is your gut. Semaglutide doesn't burn fat with a magic wand. Its main job is to trick your brain into feeling permanent satiety. How does it pull off this physiological hack? By dramatically slowing down how fast your stomach empties food. We're talking about delayed gastric emptying. This is what keeps you full for longer, that's the point, but this is where the miracle cure becomes a serious hazard. For too many users, the stomach simply slams the emergency brake. The muscles that should be pushing food into the small intestine, that crucial movement known as peristalsis, they just shut down. This is gastroparesis. Essentially, your stomach locks up. Undigested food just sits there, sometimes rotting, causing constant nausea, uncontrollable vomiting, and relentless abdominal pain. The food piles up, and the miracle shot condemns you to feel eternally sick. This damage, this paralyzed, frozen stomach, is one of the steepest bills being charged for the weight loss shortcut. Let's pull away from the frozen gut for a moment and talk about something far more sensitive: your eyesight. This is the sneaky danger nobody brings up on social media. Semaglutide is a powerhouse designed to normalize your blood sugar, and it does that very effectively. But what happens when that crucial metabolic shift is too fast, too dramatic, and too aggressive? Imagine your eye as a map with extremely delicate highways. When blood sugar levels in diabetic patients drop at a breakneck pace, it triggers a shock wave in your microcirculation. The tiny roads feeding your optic nerve get severely stressed by the abrupt change in blood flow. In rare but brutal cases, this shock can trigger non-arteritic anterior ischemic optic neuropathy, or simply NAION. In simple terms, your optic nerve, the vital cable connecting your eye to your brain, suffers from ischemia. That means it gets starved of its blood supply. Essentially, the cable is cut. It is a rare complication, yes, but it is a harsh reminder that every drastic metabolic shortcut you take comes with a silent potential risk. The drug meant to fix your weight could jeopardize the very organ that lets you see the scale. And now, let's discuss the risk that confronts thousands of people directly. In the mirror. The price of vanity. Semaglutide is an incredibly efficient fat hunter. It's so good that it doesn't give your body time to adapt.
Your skin, the largest organ we have, is elastic, yes, but it needs time to retract and tighten after a weight change. But the issue is deeper than just loose skin. Your face isn't just muscle, it's volume, and that volume is provided by your subcutaneous fat pads. These deep pockets of fat are what keep your face firm, plump, and youthful. When the molecule forces your body to torch that fat so quickly, those fat pads empty out and deflate. The result is the collapsed face, sunken eyes, hollow cheeks, and an accentuation of wrinkles that make you look, suddenly, 10 years older. It's the cruel paradox of the shortcut. You win the battle on the scale, but you lose the war against aging. The mirror reminds you that your body had to steal from your face to pay the miracle's bill.
And now, the phenomenon that has broken search algorithms and lit up social media, the viral term Ozempic vulva. We need to say this right away. Ozempic vulva is not a medically recognized diagnosis. You won't find it in any textbook or scientific journal. Instead, this viral term refers to the anatomic effect of extremely rapid fat loss that can occur when using the active ingredient semaglutide. This drug is sold under brand names like Ozempic, Wegovy, and Rybelsus, and it belongs to the powerful class of GLP-1 agonists. Now that we have the truth about the name, what is the mechanism? The vulva and the labia majora are, in large part, structures composed of adipose tissue pads, fat. Just like the face, when the body is forced to torch fat at breakneck speed, as we saw in the earlier section, it does so generally. It doesn't discriminate. The result is volume loss in the external genital area. This fat loss can make the skin appear more lax or deflated, a similar effect to what we analyzed with the cheeks and eyes. It's not a vital health risk, but it is the most intimate aesthetic paradox of all. You win the war against obesity only to have the mirror return an unexpected, irreversible anatomical change.
We've seen the face and the gut, but the final, most dangerous part of the semaglutide trap is a silent attack on your body's unsung heroes, your kidneys. The risk here is indirect, but absolutely lethal. Remember, the drug can trigger that constant, brutal gastroparesis with intense, non-stop vomiting and diarrhea. And here is the cruel math. Chronic vomiting and diarrhea equals extreme dehydration. Your kidneys are your body's main filters. They need water and stable fluid levels to function. When the chronic vomiting and diarrhea hijack the water from your system, your renal filters are starved of raw material. They get dehydrated to the point of emergency. This is called acute kidney injury. In street terms, your kidneys power down. They just stop filtering the toxic waste from your blood. Your body floods with toxins and buildup. It's a total system collapse that can lead to immediate hospitalization and even permanent damage. It's the heaviest price you can pay for the shortcut. Semaglutide forced an intestinal war, and the innocent victim of the battle was the most vital organ for cleaning your blood.
Early detection. What is your body yelling at you? If you are considering these drugs, or if you're already on them, it is vital to know the specific red flags. Your body shouts a warning before the internal collapse becomes irreversible. Pay close attention to these 3 symptoms that scream one of your vital organs is in danger. 1. For gastroparesis, the gut, a constant heavy feeling of extreme satiety that lasts for hours, even after you ate just a tiny meal. If you feel like food is literally stuck in your stomach, or you have frequent burps that taste like yesterday's dinner, that is the alarm that your peristalsis has stalled. 2. For NAION, the eye, any visual change that is sudden and painless. This isn't just an annoyance, it's a sudden blurriness or the loss of a section of your visual field, like a piece of the screen went black. This demands an emergency consult because optic nerve damage progresses silently, without pain, only with vision loss. 3. For acute kidney injury, the filter. The most dangerous symptom is a drastic decrease in urination combined with extreme thirst and confusion. When the kidneys are failing from severe dehydration, the body holds on to toxins and fluids. If you stop producing significant urine, It is an emergency that can fast-track you straight to dialysis. There you have it. Semaglutide is not a magic potion. It is a powerful medical tool that demands respect. We saw that the shortcut to weight loss comes with a bill, a paralyzed stomach from gastroparesis, a silent risk to your eyesight, facial aging from volume loss, and the most serious threat, renal collapse due to dehydration. A quick note, we are not telling you to stop this medication, nor are we telling you to start it. Our goal is strictly to make you fully aware of the benefits and the risks of semaglutide. This is information, not a prescription. Always use this drug or any powerful medication under the direct supervision of your physician or a qualified healthcare professional. The real trap is not the medication itself, but the ignorance of its consequences. Consult your physician. Weigh the benefits of this potent drug against the trap of side effects we just broke down. And if you are already using it, talk to your doctor about dehydration risks and how to protect your organs.